Welcome to you all. I am Dr.Pradyut Waghray, founder of Dr. Waghray's Lung Foundation. To give a brief introduction about our foundation, this foundation is almost about 5 years old, and we have been working on two platforms. Number one, to bring awareness about respiratory diseases in the common people, and number two, to connect the general physicians with the pulmonologists. So what I will be doing today, we are launching a new, you can say, a new initiative to talk about factors affecting the lung health. So the name of this new initiative is Lung Health. And initially, I will be giving a brief talk on how air pollution affects our lung health. I would like to invite other pulmonologists to please make use of this platform and convey their knowledge about the various factors that is affecting the lung health of our population. So we will start with the program on air pollution and lung health. So give me 2 minutes. I will just set the camera right, and then we will start our discussion on air pollution and lung health. Okay, so air pollution, as we know, it consists of harmful or poisonous substances in both outdoor or indoor air. It is harmful to people even if they do not have any lung disease, but it is particularly dangerous for those people who have asthma, chronic obstructive pulmonary disease like COPD, or any other respiratory ailments. Despite progress in recent years, air pollution continues to be a serious environmental and health problem. So let us just see what is meant by air pollution. Well, there are two common types of air pollutants that can reach unhealthy levels and can affect the lung. The first one is the ground level ozone smog, which is commonly referred to as smog. And this is formed by a chemical reaction between volatile organic compounds and nitrogen oxides. And this reaction occurs in the presence of sunlight. Okay, and these volatile organic compounds are organic compounds that can easily change to vapors or gas form. For example, the engine exhausts. Nitrous oxide gases are produced from the reactions occurring among the nitrogen and oxygen during combustion. One of the largest producers of nitrous oxide gases is vehicle engine fuel combustion. Okay, then ozone concentrations can reach unhealthy levels, especially when the weather is hot and sunny with little or no wind. Because unlike the upper atmosphere ozone, which occurs naturally and is beneficial because of its protective qualities, it is the ground level ozone. Mind you, it is a ground level ozone which is made by us. It's a man-made air pollutant that can actually have significant harmful effects on both the humans and the environment. Daily ozone levels are typically highest in the evening and lowest around the time of the sunrise. Second component causing lung health due to air pollution is the fine particulate matter, otherwise called as soot. Now, this soot refers to tiny particles or droplets in the air, which are almost nearly invisible to the naked eye. And these are usually a byproduct of combustion, such as auto exhaust and diesel exhaust, or certain power plant emissions or wood smoke. This soot can reach high levels under the same weather conditions as we have talked earlier in response to smog. It can also occur at any time of the year when there is a dry, calm, and clear conditions, because these allow particle pollution to concentrate. What does this soot do? Its soot reduces the visibility and causes the air to appear hazy when the levels of soot are elevated. And many times we confuse this with fog, but it's actually the soot which reduces the visibility and appears, to make it very hazy. So then, how does this air pollution affecting our lungs? Well, when we breathe in the air pollutants, these pollutants can irritate our airways and may result in shortness of breath, or we may cough, or people may have wheezing, or even asthma episodes, and sometimes chest pain. So shortness of breath, coughing, wheezing, worsening episodes of asthma, and chest pain. These are some of the features which we see due to air pollution. Not only that, exposure to air pollution puts us at increased risk for lung cancers, heart attacks, mind you, stroke, and in extreme cases, it can also cause premature death. To this, I would like to add one more condition called interstitial lung disease, especially idiopathic pulmonary fibrosis, where the lungs permanently get very stiff. They don't expand normally, and then the patients can die of breathlessness and lung failure. So therefore, air pollution is a definite danger to lung health. And there are certain classes of persons which are particularly at risk due to this air pollution. For example, babies and children whose normal breathing is faster than older children and adults. So they are more prone to air pollution and its repercussions. The elderly who may have a higher respiratory rates, people who work or spend their time outdoors, and also people with coexisting heart or lung disease. So then what do you do to protect from such air pollution? Well, the government has many agencies which monitor air pollution through a color-coded system, and this is called the Air Quality Index. Okay, this Air Quality Index ranges from 0 to 500. And generally, an index of 100 corresponds to the national air quality standard. So higher the air quality index values indicate greater air pollution levels and therefore greater dangers to the lung health. So then what are the effects of air pollution on our lungs? As we have talked earlier, the effect on air pollution on our lungs, they can affect the lungs depending on the type and mix of pollutants which are present in the air. They also are dependent on the concentration of pollutants and the amount of pollutant which actually enters into your lungs. So they dependent on 2 or 3 factors, not only on the type and the mixing content of pollutants present in the air, the concentration of the pollutants, and also how much quantity we inhale into our lungs. When we are exposed to high pollution levels, for example, if you are going on a busy road or during a high pollution episode, then we may experience very rapid onset of symptoms, such as irritating airways, we feel out of breath, and we start coughing. Okay, and if any, for example, a background of asthma or COPD is there, obviously these symptoms will be worsened, causing actually asthma exacerbation or a flare-up of the COPD. And we see that these asthma patients use more and more of their reliever medication. That's why we say it's very important that you use the preventer inhaler regularly in your asthma. Then there are many times questions are asked that does air pollution cause any lung conditions, any lung diseases as such? Yes, amount of research has been done on this, and this research suggests that long-term continuous exposure to air pollution can definitely contribute to development of some lung conditions. I've already quoted one lung condition like idiopathic pulmonary fibrosis. And there is also very good evidence that outdoor air pollution can contribute to lung cancer if there is a constant exposure to this lung pollutants. And it is also possible that long-term exposure to air pollution is linked to the development of asthma, and those who are having existing COPD due to their smoking history, their COPD can get worse. It is also seen that children, if they are exposed to pollution for a long time, it can actually affect the development of their lungs. And it is now enough evidence is there to show that children who grow up in highly polluted areas are more likely, or they have a higher chance of developing respiratory allergies, including bronchial asthma. So the effects of air pollution are complex. It will impact people differently depending on their health. For example, it can make existing illnesses worse. People die earlier than they should from their existing condition, and air pollution is known to contribute to increase their existing lung disease or heart disease and stroke, etc. Air pollution directly does not cause any deaths on its own, but most of the early deaths will be caused by an existing heart or lung condition, and the exposure to this air pollution may make these conditions worse. So friends, this in brief, I've given my talk on how air pollution affects the lungs. So it is our inherent responsibility to see that we actually take care and try to avoid the air pollutions, and by whatever way possible within us. And of course, the government will do its job, but we have to do our own job as well. So thank you so much. And we will be, I promise you, we will be constantly updating with the new speakers, new topics, and how the lung health can be improved in our country. Thank you so much.